This is Dr. Shakil Ahmed presenting some liver images with its logical interpretations. In this case, the color Doppler shows two vessels with different flow directions. The query is that whether it is a normal portal venous flow, whether it is a normal hepatic venous flow, normal and abnormal portal venous flow, and normal and abnormal hepatic venous flow. The middle hepatic vein in this image shows blue color, while the left hepatic vein shows flow toward the probe, and that is red. The flow in the left hepatic vein is abnormal, and the flow in the middle hepatic vein is normal. Option D, normal and abnormal hepatic venous flow, is correct. These two images belong to a patient with a cirrhosis. The grayscale image and the color Doppler image show some vessels. In this grayscale image of hepatic veins, it is evident that the lumen is tapering, while the color Doppler images show appropriately directed blood flow toward the inferior vena cava. But there is some color aliasing from the rapid velocity flow through the points of narrowing. So this is to be interpreted as narrow hepatic veins. In this image, the liver is imaged in transverse plane. The probe is in the midline. At the bottom, the bodies of the lumbar vertebrae are viewed. The anterior surface of each bone is appeared as convex hyperechoic arc. Immediately anterior to the bodies of the vertebrae, the aorta and the IVC is appreciable in its short axes. These are hypoechoic areas. Above the vessels, the liver will appear as isoechoic. To elaborate it more in details and to mark these areas, as explained, this is the anterior surface of the vertebrae, the aorta, IVC. This portion is the portal vein. The left lobe of the liver is appreciated here, while the right is here posteriorly imaged, which is bulky. And this is the diaphragm, which is separating the chest from the abdominal organs. One of the most important hyperechoic linear shadow, that is called ligament venosum, and this is the most important ligament which has a good demarcation. This is also transverse image. The probe is lying a little bit laterally or at the middle aspect. The hepatic veins are appreciated in this view. In contrast to the portal vein, these do not have an obvious hyperechoic lining. This is the portal vein, while these are the hepatic veins. The left, the middle, and the right hepatic veins will appear as three hypoechoic longitudinal projections feeding into the IVC. This is that same image with marking left hepatic vein, middle hepatic vein, right hepatic vein. That is the diaphragm, which is hyperechoic. And this area belongs to the right lobe of the liver, and this is the left lobe of the liver. Basically, the middle hepatic vein separates the left lobe from the right lobe. Now, if we move the probe most laterally to the right, we will get that image. Here, this hypoechoic area is appreciated, which is gallbladder, and this is hypoechoic, and that is posterior aspect of the liver. While more posterior to this gallbladder, there is the right kidney. The left lobe will be here and the right lobe is here. Here we can also enjoy the presence of the IVC. This is the labeled one, the right kidney, GB, the left lobe of the liver, the right lobe of the liver, and that is the IVC. Thank you for watching. Hope the message is conveyed.